Welcome to the Social Impact Journal, the podcast where we talk to change makers driving social impact around the world. I'm your host, Jack Farren, and this podcast is produced in collaboration with Rural Inclusion. Quality healthcare is out of reach for many Nigerians due to high levels of poverty and a lack of alternative options for healthcare financing. Additionally, less than 10% of waste in the country is recycled. Today, I will talk with Nonso Opurum, co-founder of SOSO Care, an innovative social enterprise allowing customers to pay for health insurance using recycled waste. In the discussion, I learn about their unique approach, discuss recent coverage with BBC Africa and Reuters, and hear how a chance encounter provided Nonso with his first idea for the company. Make sure to hit follow or subscribe and check out our social media channels at the Social Impact Journal on Instagram, LinkedIn and Twitter. Now, let's get into the episode. Welcome everybody to another episode of the Social Impact Journal, and I'm really excited for this one today. I'm joined by a social entrepreneur based in Nigeria, Nonso Opurum. Nonso, how are you?
I'm fine, Jack. How are you?
I'm very well. Thank you for joining the podcast. Maybe you can give a brief introduction of yourself and your work to our audience.
Okay, Jack, thanks for having me. My name is Nonso Opurum, and I'm the co-founder and chief growth leader of SOSO Care. At SOSO Care, our primary goal is to ensure that everyone have access to quality healthcare, irrespective of their socioeconomic condition, whether they have money or they don't have money. I started my career in banking, then moved into media management. Then I had to also go back to insurance before we founded SOSO Care as a way to enable people to have access to quality healthcare.
Thank you, Nonso. So the Social Impact Journal audience is spread across the world, and some of our listeners may not have a huge understanding about Nigeria. Maybe you can give a brief introduction to the country.
Okay, Jack, thanks very much. Nigeria is the most populous country in Africa. It's a country with over 200 million people, quite diverse. And so it's actually the biggest country, it's actually the largest country in the world with more Black people living on Earth. So it presents significant economic opportunity for us because more of the population at younger age. And even though we as an emerging country, which has greater economic opportunities, natural resources, we also face huge challenges like access to healthcare, as well as environmental management, which is one of the things that we try to tackle as SOSO Care. So, but in general, Nigeria is a very big market with Lagos that has over 20 million people living in it. So it's a huge country that comes with strong energy from different people.
Thank you, Nonso. And I'm aware that you've worked in the media sector, also in insurance and in healthcare. But before we get into that, I would like to know where your career started. So what was your first job and the story behind that?
Okay, Jack, I think when I left college during my diploma, I took internship with a bank. I was quite young. So I did internship with a bank, and the Intercontinental Bank. Now after a couple of years, the bank was acquired by Access Bank in Nigeria. So I had to then leave to complete my undergraduate and MBA, then move back to Nigeria, take up a career in back again in media when I co-founded a telemedicine solution. When I co-founded the media solution, Mayagun Diary, then which with a couple of friends, which has significant users across Nigeria. And our primary goal was, to promote good governance in Nigeria, which had more of Nigerians living in diaspora engaging on the platform. Then I took up a general job with a private company that was managing quality system for ECOWAS at UNIDO on quality systems in Africa to ensure that quality products could be exported from Nigeria to other European countries. That has been my journey. Then I had to also, at some point, pivot to start telemedicine solution, where we wanted to be able to connect doctors online, to connect patients to doctors online. But one of the things I realized then was that technology was at a very nascent stage in Nigeria. People don't have access to internet. So we had to also pivot to move into SOSO Care because we wanted to ensure that people can have access to affordable healthcare. So it's just been like jumping around, finding, But the good thing is that most of these things connect with each other. Because before I moved into SOSO Care, I had to also have a brief stop at ARM Pension, precisely a pension company that was focused on onboarding the informal sector, a very difficult market to crack. I think working in ARM pension really brought, a different perspective around informal sector, which was what I needed before we started SOSO Care.
Okay, great. So I'm aware before SOSO Care was launched from 2017 to 2019, you were leading media activities of the economic community of West African states, the EU and UNIDO on quality infrastructure. So it would be great to hear about that, some of the work and the responsibilities that you had.
I think those days our work was more focused on, advocacy and awareness, creating awareness for the institution, helping them or coordinating media activities that have to engage on their works on quality systems in Africa and building on consumer confidence. Because I think the problem Nigeria was facing then was exporting products which were below quality. So we needed to engage consumers and we needed to also engage exporters around quality products as well as the standardization of products. So that was more of our work around awareness and advocacy to let people know about quality systems.
Okay, understood. And staying on the topic of media, I know you also set up a social media blog that had over 400,000 followers. What were you specifically covering in that blog? Was that specific to Nigeria or in other African countries?
Yeah, I think it was like something we are doing for fun. I was there with two of my friends, Emmanuel and Mayowa. One of the things we focused then was we tried to do it for fun. We had access to our admin portal where you could just, it was more of, we tried to find weaknesses in government and we posted it on the internet and people made fun of it. So before we know it, it grew faster. And the only weakness we had then was it wasn't a physical blog. We were just using Facebook. So most times people who were against us keep reporting the page. Facebook have to take down the page. Before you know it again, we'll build another one, it grew. So we realized that the model wasn't sustainable. So what we primarily focused then was to, engage communities around building sustainable and transparent governance so that people can be involved in government.
Okay, great. So that was a transition from a blog on Facebook to actually working within the communities to promote that governance.
Yeah.
Great. So is that something you're still doing, or was that pre-pandemic?
No, it was a short period of time. I did it for a couple of months or years, I think a year or two before we had to shut it down because it was growing bigger. Revenues at some point started coming in, but one short challenge that we faced then was we are more focused on using Facebook marketing, using Facebook as a platform. So it was easy for Facebook to take us down. Facebook took us down 2 times. So at some point we got tired of the platform. But then you still find people go online looking for the platform now. But I currently now, Mayowa only run the platform because I had to leave the platform to do other things.
Okay, understood. So let's talk about SOSO Care now, which is the main topic of today's podcast. And it's a concept which I find so innovative and interesting in the microinsurance space. What motivated you to start this idea, and what social challenges are you looking to solve with SOSO Care?
Okay, thank you, Jack. I think what motivated me a couple of things actually motivated me to start SOSO Care, to be honest with you. I think the first part is that I wanted to, earn income for myself. To be honest with you, that's, I wanted to build a business that I could actually generate revenue and pay myself. But secondly, it wasn't just about the revenue because I could just be, then I was working on telemedicine solution where we could allow people to talk to a doctor online. But one interesting thing that happened then was that we realized that people don't even have money to buy internet. And sometimes the internet was quite bad because even if you try to talk to the doctor online, you still have to struggle with poor internet connection. And we realized that more people who need healthcare are people who live below poverty line. These are people who need simple, basic cases, talking to doctor around malaria or other things. But they cannot do it because they don't have access to smartphone and stuff like that. And there's this huge technology divide. So one day I was heading to a program in Switzerland. Then while I was waiting for a taxi by the roadside, I saw two kids, picking plastics. So casually, I just engaged them to know why they were picking plastics. I was waiting for my taxi and I was trying to talk to them. And they told me they were picking it for their mom. Their mom will give it to a local drugstore, and in exchange, the drugstore will give them some herbs against malaria. So it was then that I figured out that low-income people are trying to find a way to finance their medical needs, even though they don't have money. What if we can look at alternative way to enable people to have access to quality health care without them having to pay for it? Then I started looking at plastics. So I think when I go to Switzerland that period, I met the owner of MedGate, a telemedicine solution, and he told me that for that telemedicine to work, I need to embed it in insurance companies to pay for it. So when I got back to Nigeria, I tried to find an insurance company that would do that. I didn't see anyone. Then I tried to take up a job with ARM Pension, precisely for the informal sector. I gave myself almost a year to work there to understand the market, how insurance work, how informal sectors think. And Jack, to be honest with you, when I went to the field, one of the things I learned is that 75% of the users I met don't even know what is insurance. 80% of them don't trust insurance. They believe it doesn't work. So it was a lot of job. And when I tried to play around with, what if I give you plastic? You have to pay with plastic. Would you actually exchange plastic for quality healthcare? Most of them bought the idea, they liked the idea. So then I started playing around with the idea. So when we launched, we did a pilot to see how it would work. And in 6 weeks, we have a significant amount of people who showed interest to use the platform, exchange mostly women, exchange their plastics and other recyclables to have access to quality healthcare. That was practically how we launched SOSO Care. We launched with limited resources. We just wanted to see how it would work, and it worked, and we had to pivot and focus on it as a basis. I think after a couple of months, World Bank came in and told us that what we are doing was not, it was World Bank, I think it was UN Habitat, either one of them came back and told us from the feedback that what we are doing was not really solving environmental problem. It was not really solving healthcare problem. It was also tackling environmental problem, because sometimes plastics block waterways to turn to breeding ground for mosquitoes, which is a strong vector for malaria. So that was when we started understanding that our work was not majorly focused on access to quality healthcare and financing, but we're also tackling another problem, which is quite catastrophic, which is environmental pollution, where significant amount of Nigerians do not recycle their waste. So that has been our journey, being able to reach over 7,500 people currently, and hoping that we can be able to reach more people before the end of next year.
So this is so interesting for me, because the amount of communities I've been to in Kenya and Malawi and Uganda, in the rural areas where you see plastic all over the roads and the communities. Where are you working exactly? Are you working in villages? Are you working in urban slums?
I think our target audience are not in rural communities, because rural communities don't consume plastics. So we target urban cities, but you have suburbs in cities. You have low-income people who earn small amount of people. You have unemployed young people who are looking for alternative ways of earning income. So these are our target audience. We have two types of audience. We have the agents who help us distribute insurance in communities. Then we have our users who we encourage to exchange their ways to have insurance. So that way, it's easy for us to be able to onboard a huge number of people. So initially, we were focused on plastics as a means of premium, but now we've gone beyond plastics. We've gone into e-waste, we've gone into metal, because for us, we are constantly looking for faster ways to enable people to offset their insurance premium, with or without cash. So by being able to add other categories of waste, it makes it quite easy for someone to finance insurance premium without really depending on plastics.
Okay, so to understand this model correctly, there's a young individual who can collect plastic and takes this to one of your agents or one of your partner distributors. And I guess the plastic is weighed, and are they given points towards a premium, or how exactly does that work in the relationship with the insurance company?
Okay, what happened is that we offer embedded insurance. So it simply means that low-income people don't just want insurance because they believe that healthcare is a secondary need. Most of these people are looking for money to eat and survive. But you also want to build behavior change to let them understand that insurance is of good, important to them. And one of the things we realize is that we still have higher churn when people pay with cash. But when people exchange their trash, they keep on doing it. And when someone actually uses insurance for the first time in his life, he's never going to stop using it again because trust has been established. So how it simply works is a user can pick up his waste, use our website or use our simple USSD code for people who doesn't have smartphone. Then they can find our nearest agent, give them the waste. The agent credits the value in their wallet. So a significant a percentage of that, 7 kilograms, is debited to allow them to have access to quality health care across over 1,000 pharmacy or hospital. Then the remaining volume or quantity they have, they can convert to cash and withdraw it and use the money for other needs. But if you actually want to also use it for medical insurance, they can also keep it for medical insurance. Because initially we started as a full plastic trash to insurance, but we realized that people also needed money. So we had to also make it embedded so that people can as well earn without not just financing their insurance premium.
Okay, so 7 kilos of plastic earns them points towards their healthcare. So how much do they, so you have 1,000 pharmacies in a network that they can access.
Yeah.
So what level of service can they access if they do bring 7 kilos of plastic to one of the distributors?
Oh, because we have two kinds of plan. We have the pharmacy plan. We realize that most of our target audience honestly don't want to go to hospital because they are scared of hospital. They have this perception. Most people don't like to go to hospital. So that's why we launched the pharmacy, because we wanted to simply tackle malaria, which is quite a huge problem, creating a huge economic problem for a significant amount of families, claiming thousands of lives of young families. Jack, I know a family that lost their child because they didn't have money to buy malaria drug. So that was when we designed a simple malaria plan with 7 kg. You could actually walk into the nearest pharmacy, get access to malaria drugs, get tested for malaria. You can as well check your BP, your blood pressure, check sugar level, and all those things within a month. It's covered. It's basically a malaria plan that provides you access to malaria cover within a pharmacy. But for hospital cover, it's 10 kilograms of waste that allows you to get a hospital cover. We also use condemned car battery, which is one single condemned car battery can give you access to 6 months insurance in a hospital and give you access to 1 year pharmacy cover.
Okay, understood. Because I think one of the biggest barriers to adoption of microinsurance products across Africa is trust and awareness. And there have been so many campaigns to try and build education programs to teach people about the value of insurance. And it's so challenging. And you can use animated videos, or you can use the manuals, you can lean on trusted people in the community, but it is a challenge. So trying to give them their first taste of insurance so they can understand how a policy works and actually, receive a claim payout. That is what builds trust, but how to bring them into the sector is the challenge. So by looking at social challenge that is in the community of plastic waste or of other areas of waste, and saying that they can actually trade this in for insurance is really ingenious. So you've been working now for a few years. You currently serve 7,500 customers in Nigeria. Who is this work supported by? Do you have any donors or funders that also support the operations?
Yeah, we have a couple of donors that support our operations. Currently, we are working with GSME because we want to increase uptake of our product. So with the support from GSME, we've been able to build a USSD, improve, find the right talent that has helped us, be able to reach more families across Nigeria. We also, sometime last year, we received a grant from the government of Bangladesh. I think, it's more of experimenting what we do. It's just like Nigeria, Bangladesh also face problem of huge waste management and poor healthcare access. So we're hoping to also be able to replicate in countries like Bangladesh, where there is urgent need for healthcare intervention like Nigeria. So these are some of the simple cases of grants that we've received. So the grants, the role of the grants that we've received is to allow us to, to have a cash flow that can sustain us over a couple of time before we become sustainable as a business, at least till the end of this year. Sorry?
Understood. And within your growth plans in terms of expansion, So you mentioned Bangladesh. Is there any other countries in West Africa that you're looking at, or?
Yeah, Jack. We're looking at a couple of countries in Africa. Last year, we received call from South Africa. Today, I had a call from some people in Kenya. We've had a call from different countries in Africa. So one of the things we want to do is to, be open, be a service provider using our API. Provide more franchise service. This is one of the things we want to do because we don't want to, fiscally launch in countries. Since our USSD can work in most of these countries. So what we want to do is to open our infrastructure and access for them to be able to replicate in their countries, without us fiscally being there. So we want to focus more on light asset than being able to replicate in countries and have fiscal presence there.
Okay. Just for those in the audience that are not based in Africa, maybe you can just briefly explain what USSD is.
It's more like an offline technology, that allows you to short code offline technology. You could type #557#. That way it can allow you to do banking. It could allow you to do other services that, a full web service could do. But that way you could also, it's more a simpler way of using non-smartphone to create inclusion for people who are disconnected from using internet.
Thank you for that. So do you have a particular customer success story of someone that has been able to collect waste, or how, in terms of repeat customers, are you seeing for the average user or individual, how much waste are they bringing on a monthly basis?
I think it depends. Most people will have people who are doing SOSO care as a means of survival, source of livelihood. We have a significant number of them, and the great thing is that most of them are women. And each time I hear their stories, it motivates me to want to do more about what we do. We've had cases of a woman, a widow. I think BBC covered that. A widow with 7 kids. She had ulcer. She lost her husband from appendectomy because they didn't have money for surgery. That was why he died, from simple case that he could stay alive for that wouldn't cost more than $200. So it's quite devastating when you read stories like this. And today she has access to quality healthcare. So she's a strong advocate for us in her community. Around November, we had Reuters that came for an interview again, a documentary. They covered a family. He exchanged used car battery for a medical cover that could allow him to treat, a medical condition as well. So when we see cases like this, and sometimes I don't even hear about these cases unless we have a documentary, then we try to look at people who have strong stories to, validate what we do. So most times we receive significant feedback from people. We have people who actually had small businesses, women who are earning smaller income, and because of medical condition of their children, they had to use the entire money to treat their children from out of pocket. So using SOSO Care has helped them significantly to unlock income opportunities for themselves. So for us, it's about the impact that we do. We measure the impact and see how it's changing lives. Helping people stay healthy, helping people to be able to finance cough syrup, get access to simple medical needs like malaria. Jack, to be honest with you, if as a business we are able to provide medical care for malaria care for at least 5 million people, I can tell you that we have done well, even if we close in another year's time.
For sure. And when you mentioned some of those documentaries to highlight the work from BBC Africa and Reuters, I can include them in the show notes. So if anyone is listening and wants to see videos of SOSO Care and the impact that they are having in Nigeria, then you can access that in the show links. So SOSO Care is growing, and you're really tackling the access to finance for insurance, access to healthcare, and also environmental concerns as well. But what is the biggest obstacle or challenge in this journey that you have been able to overcome?
I think honestly, one of the biggest challenges we've been able to overcome is access to funding, capital. Because I started a telemedicine solution with a lot of funds. I played around with a lot of things. Then it failed. Then what it did for me was to start SOSO Care in a very frugal way. And when we had to figure out a way, initially the biggest problem we faced was infrastructure. How can we build stronger infrastructure in waste management collection? So we are relying on existing waste management companies to help us collect waste on our behalf. So that meant I had to be in significant amount of meetings every day, trying to convince waste management companies, to offer a solution. Most of them were not buying into it. So what we did is, to build our own infrastructural rails. That means we had to build agents. We have to build 400 agents across communities, to be able to collect this waste on our behalf for us to process and sell. So when we started doing that, it was more like a blue strategy for us. We have invested in that. We started building them. They became our biggest advocate in communities. They became our fastest way to onboard users. So it was easy for us then to have more of these existing waste management companies come back to us again and say, okay, we want to partner with you. We've partnered with a couple of them and we keep on partnering with them, because now they now see us more as a threat. So what we try to do most times is to let them understand that we are complementing their work and not try to compete with them. So it's been a symbiotic relationship between us and them so far, and we hope to even do more across cities, not in Nigeria.
Okay, excellent. On this podcast, many of the guests that I talk with, I've met along my travels in Africa and Latin America, and I'm always really interested to talk to social entrepreneurs about where they have traveled with their work, maybe to conferences or to events or to learning trips. So where would be your favorite place that you have had the opportunity to travel with SOSO Care or with a previous venture, and why?
I've been privileged to visit a couple of countries, but I think one of the best countries I've visited the best country I visited last year, which I think it's Rwanda. I was in Kigali around November, December. What I remember, the genocide that happens in Kigali and the growth process in Kigali, how the GDP is growing, the level of security in Kigali, it gives me confidence about Africa and economic opportunities and the future that Africa holds. I always talk about Kigali to people. I never expected to see Kigali as amazing as I met it. So it was very beautiful and it was inspiring. And in terms of business, I think Kigali offered me more business opportunity than every other place I've visited. It's like it offers significant revenue for us, being able to meet people who are willing to partner with us that year, that we're also exploring more of this collaboration this year. So I think in summary, it's Kigali for me.
That's an excellent choice. I was in Kigali late 2021. There's so many things moving there, and there's so many innovations happening. I remember I went to a conference on microfinance, and I was shocked at the conference center. I'm not sure if you went there.
Where? Sorry.
The Kigali Convention Center.
No, I didn't go there.
No, okay. No, it's a fabulous city with lots of things. That's an excellent choice. So I think we're coming towards the end of the podcast today. But if you were to have your own social impact journal and a page to write down some advice to a young person who's looking to go out on their own social entrepreneurship journey, what one piece of advice have you learned along your journey that you could share with them?
I think for me, it's about being resilient. You just have to love what you do. There are times when you wake up in the night, you ask yourself, are you on the right track? Are you doing what is right? But if you remember the number of people, for me, it's like last week, someone was telling me that, if I think about the number of families that will put food on their tables every day as SOSO Care, it's amazing what could happen if we close that as a business. So for me, it's these small things that inspire me. And if you want to go in the path of entrepreneurship as a social entrepreneur, one of the things I advise people, younger people, is do it for the passion, believe in what you do, also be open to be flexible, listen to feedbacks, and importantly, be resilient, because it's really going to be hard. But if you are willing to take your time on it, fight for it, definitely you will come out strong.
Thank you so much, Nonso. And thank you for being here today on the Social Impact Journal.
Thank you very much, Jack. Thanks for having me.